Why is it critical to document the use of standardized descriptors for abnormalities in physical examination documentation, and what risks arise from inconsistent terminology? Answer: documenting standardized descriptors for abnormalities in physical examination is essential to ensure clarity and accuracy in patient care. These descriptors help all healthcare providers understand a patient's condition uniformly, reducing the risk of miscommunication and diagnostic errors. Standardized terminology ensures that everyone, from physicians to medical coders, interprets the clinical findings the same way, which is crucial in both treatment planning and billing processes. For example, the descriptor wheezes indicates a specific type of sound heard during auscultation, commonly associated with obstructive airway diseases like asthma. If another provider uses the term rattling breath without specifying the context or meaning, it could lead to confusion regarding the patient's condition. The risks of inconsistent terminology are significant. First, it can result in misinterpretation by other healthcare providers, leading to incorrect diagnosis or improper treatment. Second, legal exposure can arise if inconsistent terminology is used in documentation and it leads to poor clinical outcomes. Lastly, inconsistent documentation can result in billing errors as insurance companies rely on clear and accurate descriptions for reimbursement. If documentation doesn't follow regulatory coding standards like ICD-10, the healthcare provider risks claim denial or even audit scrutiny from payers like Medicare and private insurers. The Centers for Medicare and Medicaid Services (CMS) stresses the importance of accurate and consistent documentation to maintain compliance with healthcare standards, including those related to the quality of care provided. Dr. Patel documents wheezes heard bilaterally during auscultation. Later, the patient's attending physician disagrees with this finding, noting, "Fine crackles. How should this discrepancy be documented and resolved according to best practices?" Answer: in this scenario, Dr. Patel must ensure that both the original and revised findings are properly documented in the medical record. The discrepancy should not be ignored, as accurate and complete documentation is crucial for continuity of care and compliance with healthcare standards. Steps Dr. Patel should take: document the initial findings clearly. Dr. Patel should record the exact description of the findings, including relevant details like location and timing, e.g., wheezes noted in the right lung base on expiration. Create an addendum. If the attending physician disagrees with the findings, Dr. Patel should not alter the original note. Instead, an addendum should be added to the record indicating the attending physician's findings. Upon further evaluation, the attending physician noted fine crackles on auscultation in the bilateral lower lobe. Ensure both findings are documented accurately. If both assessments are valid based on different clinical observations, they must be documented separately with clear timestamps and the rationale behind the differing assessments. Resolution guidelines. Both providers should work collaboratively to ensure clarity, and the final diagnosis or treatment plan should reflect the most current and accurate data. Following American Medical Association (AMA) and Joint Commission standards, discrepancies in documentation should be addressed immediately and with transparency. Healthcare institutions may have policies in place for handling such conflicts, often requiring a peer review or clinical consultation. Describe the importance of documenting both quantitative and qualitative data during a physical examination, providing examples of each. Answer: documenting both quantitative and qualitative data is essential in physical examination to provide a full picture of the patient's health status. Quantitative data are measurable, objective facts that assist in establishing a diagnosis and determining the severity of a condition. Qualitative data, on the other hand, provide descriptive insights that help contextualize the patient's experience and symptoms. Quantitative data, vital signs, blood pressure of 128 mmHg, heart rate of 72 beats per minute, or temperature of 98.6 F are objective measures that can be tracked over time to assess changes in the patient's condition. Laboratory results, blood glucose level of 150 below, a chest X-ray showing a lung mass can confirm or refute clinical suspicions. These provide specific, verifiable facts that can be used in diagnosis. Qualitative data, symptoms, descriptions of the patient's subjective experience, like a sharp pain or dizziness upon standing, help to add context to the clinical findings. Observations, descriptive terms like a patient appears anxious or skin appears flushed provide a fuller understanding of the patient's condition, which is important for making treatment decisions. The American Medical Association (AMA) and Centers for Medicare and Medicaid Services (CMS) recommend that all relevant clinical data be documented. Quantitative data provide objective support for diagnosis, while qualitative data add the necessary context for decision-making, making both equally important in ensuring accurate diagnosis and appropriate treatment. MS. Carter, a 50-year-old patient, presents with a complaint of abdominal pain. Dr. Lopez records diffuse tenderness in all 4 quadrants. What further steps must Dr. Lopez take to ensure compliant documentation and appropriate diagnosis? Answer. In this scenario, Dr. Lopez has documented a general finding of a diffuse tenderness, which is a good starting point but lacks the specificity needed for thorough documentation and accurate diagnosis. For proper documentation and diagnostic accuracy, the following steps should be taken. Clarify and specify the finding. Instead of just diffuse tenderness, Dr. Lopez should specify whether the tenderness is associated with specific structures, e.g., rebound tenderness noted in the right lower quadrant. This provides more useful clinical detail. Quantify pain. Documenting the severity of pain is crucial. For example, patient reports pain severity of 8 or patient reports pain that worsens with palpation would offer a clearer picture of the patient's experience. Linked to potential diagnosis. Dr. Lopez should consider and document possible diagnoses, including a differential diagnosis, e.g., appendicitis, diverticulitis, gastroenteritis. This would involve ordering relevant lab tests, e.g., CBC amylase and imaging, e.g., abdominal ultrasound or CT scan. Document associated symptoms. Any associated symptoms like nausea, vomiting, or fever should be noted, as they may provide additional insight into the underlying cause of the pain. Best practice. Dr. Lopez must follow American College of Physicians guidelines, ensuring that all findings are linked to potential diagnosis and justified with the appropriate clinical reasoning and test results. Accurate and thorough documentation is critical not only for patient care but also for legal and reimbursement purposes. Explain the significance of linking clinical findings to diagnostic codes in treatment plan documentation. Answer. Linking clinical findings to diagnostic codes is crucial for several reasons, particularly in ensuring the accuracy of the patient's medical record, supporting reimbursement, and maintaining compliance with healthcare regulations. Diagnostic codes, such as those in the ICD-10 system, are used to classify diseases, conditions, and other health-related issues. Properly linking clinical findings to these codes ensures that the diagnosis is clearly understood and accurately represented. Significance. Clinical accuracy. Coding ensures that the diagnosis documented reflects the findings, allowing for appropriate treatment planning. For example, if a patient presents with chest pain and a subsequent ECG confirms myocardial infarction, the code for MIA should be linked to the chest pain symptom R.9. Reimbursement. Insurance companies and Medicare rely on accurate coding to determine reimbursement rates. If clinical findings are not linked to the correct diagnostic codes, the claim may be denied or underpaid. Continuity of care. Other healthcare providers who access the medical record can rely on the codes to understand the patient's condition, helping in cross-specialty treatment and preventing duplication of tests or procedures. Guidelines. CMS mandates the accurate use of ICD-10 codes for all clinical documentation to ensure that treatments are covered and reimbursed appropriately. National Correct Coding Initiative (NCA) guidelines emphasize that diagnosis codes must be supported by documentation to avoid errors in reimbursement. Mr. Johnson, a 45-year-old diabetic patient, visits for a follow-up. Dr. Kim documents a treatment plan for poorly controlled blood sugar but does not include updated lab results or the patient's adherence history. What risks does this omission pose, and how can it be rectified? Answer. The omission of updated lab results and the patient's adherence history poses several risks to both patient care and legal compliance. Risks inadequate care. Without updated lab results, such as the most recent HbAC levels, Dr. Kim cannot accurately assess the patient's glycemic control or adjust treatment. Legal exposure. Incomplete documentation can expose the healthcare provider to liability if complications arise. If Mr. Johnson's condition worsens due to inadequate documentation, it could lead to a malpractice claim. Missed opportunities for patient education. Adherence history is critical for understanding whether Mr. Johnson is following his treatment plan. Omitting this detail means Dr. Kim may not be addressing barriers to treatment or reinforcing necessary lifestyle changes. Rectification. Dr. Kim should immediately update the documentation with lab results, including the most recent HbAC levels, fasting blood sugar, and any other relevant tests. The treatment plan should include the patient's adherence to medications, diet, and exercise, and any obstacles faced should be discussed. Additionally, the plan should set specific, measurable goals for future follow-up, such as improving glycemic control within a set time frame. Best practice. According to the American Diabetes Association data guidelines, regular monitoring of blood glucose levels and adherence history is crucial for managing diabetes effectively. Dr. Kim should document these elements to ensure proper follow-up care and avoid potential complications. Why is it critical to document both the primary and secondary diagnoses in clinical documentation, and how does this relate to reimbursement policies? Answer: documenting both primary and secondary diagnoses is a key aspect of comprehensive clinical documentation. The primary diagnosis is the main condition that prompted the patient's visit or hospitalization, while secondary diagnoses are additional conditions that either contribute to the primary condition or are coexisting but require attention. Importance: complete clinical picture. Accurately documenting both primary and secondary diagnoses allows for a more complete understanding of the patient's condition. For example, if a patient with diabetes presents with a foot infection, the primary diagnosis might be the infection, while the secondary diagnosis could be diabetes, as it affects the patient's wound healing, treatment, and management. The documentation of secondary diagnosis helps to guide the treatment plan, as additional medical conditions may require different medications, therapies, or procedures. For example, a patient with hypertension and heart failure may need a different treatment strategy than one without hypertension. Reimbursement compliance. Accurate documentation of both types of diagnosis is essential for proper reimbursement. Insurers, including Medicare, rely on the ICD-10 codes to determine the appropriateness of care and the reimbursement amount. Failure to document secondary diagnosis may result in under-reimbursement. For example, a secondary diagnosis of diabetes or obesity could justify the need for more intensive management, which impacts reimbursement rates. Regulatory considerations. The Centers for Medicare and Medicaid Services, CMS, and the American Health Information Management Association, HEMA, both emphasize the importance of including all relevant diagnoses in the medical record for coding purposes. Inaccurate or incomplete documentation of diagnoses can lead to claim denials, compliance issues, or audit risks. Mr. Harris, a 60-year-old male with chronic obstructive pulmonary disease, COPD, and a history of smoking, presents with worsening shortness of breath and productive cough. Dr. Thomas documents a diagnosis of COPD exacerbation but does not note the patient's smoking history or recent changes in medication. What documentation improvements should Dr. Thomas make? Answer: in this scenario, Dr. Thomas's documentation should be enhanced to reflect a comprehensive and accurate clinical picture of Mr. Harris's condition. Steps for improvement. Document smoking history. Mr. Harris's history of smoking is a critical factor in managing COPD. Dr. Thomas should document the number of years Mr. Harris has smoked, how many cigarettes he smokes per day, and whether he has tried to quit. This is important for risk assessment and for justifying the diagnosis and management plan. Record COPD exacerbation details. The diagnosis of COPD exacerbation should be supported with more specific information. For example, Dr. Thomas should include the severity of the exacerbation, such as whether Mr. Harris is experiencing an increased number of exacerbations or more severe symptoms, e.g., difficulty speaking or walking due to shortness of breath. Medication history and changes. Any recent changes in medications, especially those related to COPD management, must be documented. Dr. Thomas should record whether Mr. Harris has been prescribed antibiotics or steroids for the exacerbation and whether the patient has been adherent to prescribed therapy. Linking secondary diagnoses. If Mr. Harris has any other comorbidities, such as hypertension or heart disease, these should be documented as secondary diagnoses, as they could complicate the management of COPD and may require different treatments. Regulatory compliance. According to National Institutes of Health (NIH) guidelines and CMS policies, comprehensive documentation is vital to justify the diagnosis, treatment plan, and resource allocation for COPD patients, especially in complex cases like exacerbations. Detailed documentation also supports appropriate billing and reimbursement. What role does the documentation of clinical procedures play in coding and reimbursement, and what should be included in the documentation of invasive procedures? Answer: documentation of clinical procedures plays a crucial role in both coding and reimbursement processes. Proper documentation ensures that the services rendered are accurately represented in the medical record, supporting appropriate billing and helping avoid underpayment or denial of claims. Role in coding and reimbursement. Detailed procedure description. The documentation should provide a clear, detailed description of the procedure, including the indication why the procedure was performed, method, how it was done, and results. This level of detail ensures that the procedure can be correctly mapped to the appropriate CPT code, current procedural terminology, which is used for billing purposes. Invasive procedures. For invasive procedures, such as surgeries or diagnostic interventions, additional details must be included. For example, for a laparoscopic appendectomy, documentation should include the type of surgery performed, the approach, e.g. laparoscopy, any complications, and post-operative care instructions. Impact on reimbursement. Accurate documentation of procedures directly impacts reimbursement from insurers and government programs like Medicare. If the documentation is incomplete or vague, the procedure may be denied or incorrectly reimbursed. For example, if a procedure is documented only as surgery but without the specific CPT code or necessary detail, the claim might be underpaid. Regulatory guidance. According to the American Medical Association, AMA, and CMS, every procedure must be supported by detailed, accurate documentation reflecting both the complexity of the procedure and the resources required to perform it. Failing to provide thorough documentation can result in non-compliance with regulatory requirements, leading to audit risks. How can documentation practices impact the continuity of care in a multidisciplinary healthcare team? Provide an example. Answer. Effective documentation is critical in promoting continuity of care, particularly in multidisciplinary healthcare teams where multiple providers contribute to a patient's care. Accurate, timely, and clear documentation ensures that all providers involved in a patient's care are working with the same information, which reduces the likelihood of errors, redundant tests, and conflicting treatment plans. Impact on continuity of care. Information sharing. Documentation acts as the bridge between different specialties. For instance, a cardiologist reviewing a patient's history of chronic heart failure needs to know the latest treatment regimen prescribed by the primary care provider, as well as any other health issues, e.g., diabetes or kidney disease, that could influence management. Comprehensive treatment plans. If a patient is receiving care from both a physical therapist and an orthopedic surgeon, accurate documentation of physical therapy progress and any changes in the surgical plan ensures that the providers are aware of one another's actions and can avoid duplicating efforts or causing harm. Avoiding errors. Lack of coordination or communication due to poor documentation can lead to serious errors. For example, if a patient's medication list is incomplete or outdated, a new provider may inadvertently prescribe a contraindicated drug, leading to adverse reactions. Example, if a patient with rheumatoid arthritis is being treated by a rheumatologist for joint pain and a cardiologist for heart disease, both specialties must document and communicate clearly. A poorly documented medication regimen, including potential drug interactions, could lead to mismanagement. For instance, NSAIDs prescribed for joint inflammation could exacerbate heart failure, and clear documentation of both specialties would prevent this issue. Regulatory standards. The Joint Commission and CMS both emphasize the importance of accurate and thorough documentation to support continuity of care, ensuring that all providers are informed and involved in a patient's treatment decisions. Why is it essential to document post-procedural outcomes, and what are the potential risks of inadequate documentation in this area? Answer. Post-procedural outcome documentation is crucial for several reasons. It serves as a critical means of continuity in patient care, providing subsequent healthcare providers with detailed insights into the patient's response to surgery or procedures. This includes documenting any complications, unexpected outcomes, or signs of recovery. Proper outcome tracking helps healthcare providers identify early complications, tailor follow-up care, and improve patient safety. Inadequate documentation can have severe consequences. Firstly, patient safety may be compromised due to a lack of crucial information that could inform subsequent interventions or follow-up care. Secondly, incomplete or absent documentation can lead to medico-legal liabilities, as the healthcare provider may be unable to demonstrate that appropriate steps were taken to manage risks or complications. In the event of a lawsuit, poor documentation can hinder the defense of medical decisions. Furthermore, billing issues can arise from insufficient documentation, as insurance providers and payers require comprehensive and accurate records to validate claims. For example, Medicare and other insurers have stringent documentation requirements under CMS, Centers for Medicare and Medicaid Services, regulations, and failure to comply may result in claim denials or delayed reimbursements. Documentation standards such as those from the Joint Commission and the National Quality Form (NEF) underscore the necessity of accurately capturing post-procedural outcomes to support quality of care, patient safety, and regulatory compliance. Discuss the importance of feedback loops in CDI programs and the challenges associated with implementing them effectively. Answer. Feedback loops are integral to clinical documentation improvement. CI programs as they ensure that healthcare providers receive real-time actionable feedback on their documentation practices. These loops help to address any gaps in documentation, enhance the accuracy of medical records, and ultimately improve the quality of care provided to patients. By fostering a collaborative process, feedback loops ensure that clinicians are aware of any deficiencies and have the opportunity to make corrections promptly. This can lead to better coding accuracy, which is essential for proper reimbursement and maintaining compliance with CMS guidelines. The challenges of implementing effective feedback loops include resistance to feedback. Clinicians may perceive feedback as critical or punitive, which can reduce the willingness to participate in CDI efforts. CDI specialists must therefore foster a culture of collaboration and continuous improvement. Resource constraints. Effective feedback requires the support of CDI staff, technology tools, and training. Institutions with limited resources may struggle to provide consistent, high-quality feedback. Accuracy of metrics. In order for feedback to be useful, the metrics used to track documentation accuracy must be valid and actionable. Poorly defined metrics can result in ambiguous feedback that is difficult for clinicians to implement. To mitigate these challenges, healthcare organizations should prioritize ongoing education for staff, utilize CDI software tools to streamline feedback, and ensure that feedback is constructive and aligned with clinical and regulatory guidelines such as AHIMA's documentation guidelines. Dr. Patel orders a CT scan for a patient presenting with severe abdominal pain. The order specifies rule out appendicitis. The imaging report indicates findings consistent with diverticulitis. What documentation steps should Dr. Patel and the clinical team take to ensure compliance and accurate reporting? Answer: in this scenario, Dr. Patel must ensure that the patient's medical record reflects the change in diagnosis from the initial suspicion of appendicitis to the confirmed diagnosis of diverticulitis. The steps include updating the diagnosis. Dr. Patel should document the confirmed diagnosis of diverticulitis in the patient's progress notes and medical record. The ICD-10 centimeter code for diverticulitis should be used to reflect the condition accurately. Clinical correlation. Dr. Patel must provide a clear explanation of the thought process leading to the diagnosis, indicating how the imaging findings correlate with the patient's clinical presentation. This helps justify the change from the initial suspected diagnosis of appendicitis. Treatment plan. It is essential to document an updated treatment plan based on the new diagnosis. This includes any prescribed medications, surgical interventions, or recommendations for follow-up care. These actions ensure compliance with regulations such as CMS's Conditions of Participation (COPS), which require that medical records are accurate and complete. Explain how documenting surgical and interventional procedures differs from routine medical documentation and the risks of non-compliance with procedural standards. Answer: documenting surgical and interventional procedures requires far more detail than routine medical documentation due to the complexity and high-risk nature of these interventions. The documentation for such procedures should include preoperative diagnosis, the medical reason for performing the surgery or procedure including any relevant patient history, surgical details, a detailed description of the procedure including techniques used, instruments, and any complications encountered, post-operative status, information regarding the patient's recovery, immediate complications, or need for further interventions. This level of detail is essential to ensure patient safety and accurate billing. Non-compliance with procedural documentation standards poses several risks. Compromised patient care. Lack of detailed documentation may result in inadequate follow-up care, as subsequent providers may not have a full understanding of the procedure or potential complications. Legal liabilities. In the event of a malpractice claim, incomplete surgical documentation can severely hinder providers' defense as it may not demonstrate appropriate care was given. Regulatory penalties. Non-compliant documentation may lead to penalties under CMS regulations or state licensing boards. The Joint Commission and other accrediting bodies require adherence to strict documentation protocols to maintain hospital accreditation. Healthcare providers must follow guidelines set forth by organizations like AORN, Association of Perioperative Registered Nurses, and CMS to ensure compliance and reduce these risks. Which key metrics should CDI specialists track to assess the success of a CDI program, and why are these metrics critical? Answer: key metrics are essential for evaluating the success of a CDI program as they reflect the quality and effectiveness of the documentation practices in place. These metrics include Case Mix Index, CMI. This metric reflects the acuity and complexity of a hospital's patient population. A higher CMI indicates that the hospital is accurately documenting the severity of illness and complexity of care provided. This directly impacts reimbursement from insurers like Medicare. Query response rates. A high query response rate indicates that clinicians are engaging with the CDI team and addressing documentation gaps. Tracking this metric helps assess clinician participation in the improvement process. Audit outcomes. Regular audits of clinical documentation ensure that it complies with ICH 10 cm and ICH 10 PCS guidelines. Positive audit outcomes demonstrate that the CDI program is successfully improving coding accuracy. These metrics are crucial because they help identify areas where documentation can be improved, and they ensure that the CDI program is contributing to both regulatory compliance and financial performance. How should a healthcare organization document adverse outcomes from a procedure to comply with regulatory and legal requirements? Answer: documenting adverse outcomes from procedures is a critical aspect of ensuring compliance with both regulatory standards and legal requirements. Healthcare organizations must adhere to specific guidelines to ensure proper documentation of these events. Immediate documentation. The adverse event should be documented as soon as possible after it occurs, including a detailed description of the event, the patient's symptoms, and the actions taken by healthcare providers. This helps create an accurate record of what transpired. Incident reporting. Healthcare organizations should have an incident reporting system in place to track adverse events. This documentation must include the event's details, the affected patient's medical record, and any corrective actions taken. Root cause analysis. A root cause analysis should be performed to identify any underlying factors contributing to the adverse outcome. This analysis should be documented in the patient's record and in internal quality improvement reports. Inadequate documentation of adverse outcomes can lead to serious consequences, including regulatory penalties from bodies like CMS and the Joint Commission. Additionally, poor documentation can increase the risk of legal liabilities, as insufficient records can make it difficult to defend healthcare providers in lawsuits. Regulations like the Patient Safety and Quality Improvement Act encourage reporting and analysis of adverse events to improve care quality and prevent future incidents. What are the risks associated with incomplete documentation of test results, and how can CDI programs mitigate these risks? Answer: incomplete documentation of test results can lead to significant risks, including delayed treatment. If test results are not properly documented, healthcare providers may not have access to critical information in a timely manner, potentially delaying necessary treatment. Billing denials. Insurance companies may deny claims if there is insufficient documentation to support the medical necessity of tests or procedures. Legal and regulatory issues. Incomplete documentation of test results can expose healthcare organizations to legal liabilities, particularly if a misdiagnosis or delayed treatment leads to patient harm. CDI programs can mitigate these risks by implementing the following strategies: standardized protocols. Establishing protocols for documenting test results ensures consistency across the organization. Training and education. Providing ongoing training for clinical staff on the importance of documenting test results accurately and in real time. Integration with EHR systems, ensuring that test results are integrated into the electronic health record system so they are easily accessible and properly documented. Describe the role of a CDI specialist in supporting accurate diagnosis, coding, and reimbursement. Answer: a CDI specialist plays a pivotal role in supporting accurate diagnosis, coding, and reimbursement by working closely with healthcare providers to ensure that clinical documentation reflects the severity of the patient's condition and the care provided. The primary responsibilities of a CDI specialist in this area include clarifying documentation. CDI specialists collaborate with clinicians to clarify diagnoses and ensure that they are accurately documented. This includes querying providers for additional information or clarification when necessary. Ensuring compliance. They ensure that the documentation complies with ICH 10 cm and ICH 10 PCS coding guidelines, which directly impact reimbursement rates under the Prospective Payment System (PPS). Providing education. CDI specialists educate clinical staff about the importance of detailed documentation to support accurate diagnosis coding, which helps maximize reimbursement and minimize claim denials. Accurate documentation is critical for proper reimbursement under Medicare and private insurers. When documentation is unclear or incomplete, it can lead to underreporting of diagnoses, which may result in reduced reimbursement or audit risk. How can CDI programs address physician documentation challenges related to chronic conditions and comorbidities? Answer: physician documentation challenges related to chronic conditions and comorbidities can often arise due to time constraints, lack of familiarity with coding guidelines, or unclear clinical indications. CDI programs can address these challenges by implementing the following strategies: education and training, providing physicians with targeted education about the importance of documenting chronic conditions and comorbidities thoroughly, including the clinical rationale for treatment and management plans. Utilizing CDI queries when documentation of chronic conditions or comorbidities is unclear. CDI specialists can use queries to request more specific information. Leveraging technology. Utilizing clinical decision support systems (CSS&E), HR tools can help prompt physicians to document important chronic conditions and comorbidities accurately and consistently. Accurate documentation of these conditions is essential not only for appropriate patient care but also for ensuring proper reimbursement and case mix index (CMI). It also prevents underreporting of the severity of illness, which could negatively impact the healthcare institution's financial standing and quality metrics. How does CDI contribute to the quality of care in hospitals, and what metrics demonstrate its effectiveness? Answer: clinical documentation improvement. CI programs significantly contribute to improving the quality of care in hospitals by ensuring that patient records accurately reflect the level of care provided, which impacts clinical decision-making, care coordination, and patient outcomes. The key contributions of CDI to quality care include accurate diagnosis documentation. Ensuring that all diagnoses, including comorbidities, are clearly documented helps providers make informed decisions about patient care. Enhanced communication. CDI programs promote better communication between clinical staff, which improves the overall quality of care by ensuring that all providers have access to complete, accurate patient information. Improved compliance and reimbursement. Accurate documentation supports appropriate reimbursement from insurers, which allows hospitals to reinvest in patient care services. Metrics that demonstrate the effectiveness of CDI programs in improving care quality include reduction in remission rates. Accurate documentation helps in identifying high-risk patients and tailoring appropriate discharge plans, which can reduce hospital remissions. Improved patient safety indicators. The thorough documentation of diagnoses and treatments helps identify potential risks and complications early. Positive audit outcomes. Successful audits of medical records by external agencies demonstrate that the CDI program is effective in improving documentation accuracy, which supports quality reporting initiatives. In essence, CDI programs are integral to ensuring both clinical accuracy and financial sustainability, contributing to better patient outcomes and hospital performance. Electronic health records (EHR) systems include tools like templates, voice recognition, and decision support. How can the misuse of these tools adversely affect the quality of clinical documentation? Provide examples and strategies for mitigating these issues. Answer: the misuse of HR tools can result in copy-paste errors. Repeating incorrect or outdated information leads to inaccuracies and jeopardizes patient safety. Over-reliance on templates can lead to generic, incomplete, or non-patient specific documentation, compromising the legal and clinical validity of records. Voice recognition errors. Misinterpreted medical terms can result in inaccuracies if not carefully reviewed. To mitigate these issues, training programs ensure that clinicians understand best practices for using templates and voice recognition. Audit systems, regular audits to detect and correct errors. Customization, tailoring templates to specific clinical scenarios to minimize irrelevant information. Relevant guidelines. AHIMA's guidelines for HR documentation integrity emphasize accuracy, completeness, and traceability of records. Dr. Patel frequently uses copy-paste functionality to streamline her documentation workflow. During an audit, it was discovered that several patient records contained duplicated information unrelated to the patient's current condition. What steps should the hospital's clinical documentation improvement (CI) team take to address this issue, ensuring regulatory compliance and documentation accuracy? Answer: the CDI team should educate Dr. Patel on the risks of copy-paste errors, including patient safety implications and regulatory violations. Review policies. Implement a policy limiting copy-paste usage to sections with verified and relevant data. Auditing. Develop a tracking mechanism to monitor copy-paste activities. Technology solutions. UC. HR tools that flag repetitive entries or provide alerts for potential inaccuracies. Regulatory perspective. The Centers for Medicare and Medicaid Services (CMS) and Office of Inspector General OIG caution against copy-paste misuse due to its impact on billing integrity and fraud risks. How can AI-powered clinical decision support (CDS) tools enhance the accuracy and efficiency of clinical documentation in HR systems, discuss potential risks and mitigation strategies. And so AI-powered CDS tools enhance accuracy by suggesting relevant codes and ensuring adherence to documentation standards, improve efficiency by automating repetitive tasks, allowing clinicians to focus on patient care, reduce errors by identifying inconsistencies in documentation, risks. Over-reliance on automation can lead to overlooking clinical nuances, bias in algorithms, may skew recommendations based on incomplete or biased training data. Mitigation. Regularly review and update AI algorithms to align with current standards. Combine AI tools with human oversight to ensure nuanced decision-making. Relevant guidelines. ONC guidelines on AI in HRS emphasize a balanced approach combining automation and clinician input. Describe the differences between retrospective and concurrent audits in the context of CDI programs. Which method is more effective in identifying and resolving documentation errors, and why? Answer. Retrospective audits, conducted after patient discharge, allow comprehensive review but may delay corrective actions. Concurrent audits, performed during active patient care, enable real-time error correction, improving documentation and coding accuracy. Effectiveness. Concurrent audits are generally more effective as they reduce the risk of perpetuating errors and facilitate immediate intervention. Retrospective audits are useful for systemic evaluations and identifying broader trends. Relevant law. CMS conditions of participation, COPS, emphasize real-time accuracy and completeness in documentation, favoring concurrent audits for compliance. Nurse Clara repeatedly documents inaccurate medication dosages in patient charts discovered during a routine audit. These errors have not yet resulted in patient harm but pose significant risks. What corrective actions should the CDI team recommend to address this issue, and how should future risks be minimized? Answer. Steps for corrective action. Targeted training. Educate Nurse Clara on accurate documentation practices and the importance of medication accuracy. Supervised practice. Implement a short-term mentorship program to oversee her documentation. Policy review. Ensure robust protocols for medication reconciliation and error prevention. Future risk minimization. UC. HR alerts for dosage anomalies. Conduct regular audits focusing on high-risk documentation areas. Relevant guidelines. The Joint Commission's National Patient Safety Goal, EPEDS, stressed the importance of accurate medication documentation. What are the legal implications of overuse or misuse of standardized templates in clinical documentation, particularly in litigation cases? Answer. Overuse of templates can result in generic documentation, failing to reflect individual patient conditions, inconsistencies, contradictory information undermines credibility. In litigation, poorly documented records may lead to questions about clinician competency, increased liability due to incomplete or inaccurate documentation. Mitigation. Use templates as a guide, ensuring customization for each patient. Regularly update templates to align with current standards of care. Relevant law. Health information technology for economic and clinical health, high-tech mandates accurate and meaningful use of AIs. Explain how root cause analysis, RCA, can be applied to address frequent coding errors identified in clinical documentation. Answer. Root cause analysis, RCA, is a structured method used to identify the underlying causes of recurring issues in clinical documentation, such as frequent coding errors. The process typically follows these steps. Problem identification. The first step is to define the nature and frequency of the coding errors. For example, are they related to misinterpretation of clinical notes, incorrect coding of diagnosis, or procedural inconsistencies? Data collection and analysis. Once the problem is identified, the next step is to gather relevant data. This could include reviewing medical records, analyzing coding trends, and interviewing clinical staff. The goal is to determine whether the errors are isolated incidents or part of a broader systemic issue. Cause identification. Through systematic investigation, common causes of errors are identified. These might include issues like unclear physician documentation, inadequate coder training, or lack of access to up-to-date coding guidelines. This phase often reveals process gaps, such as physicians not providing enough detail in their notes or coders misinterpreting ambiguous terminology. Solution development. After identifying the root causes, targeted interventions are implemented. This might include updating documentation templates, providing coding workshops, or instituting peer reviews for complex cases. Continuous improvement. The final step is to monitor the effectiveness of corrective actions and make adjustments as necessary, fostering an environment of ongoing quality improvement. By addressing the root causes, RCA helps in reducing coding errors, improving the accuracy of clinical documentation, and ensuring compliance with regulations like HIPAA and CMS. AI-driven natural language processing (NLP) tools are increasingly used in CDI. What are the key considerations for implementing these tools while maintaining compliance with HIPAA? Answer: when implementing AI-driven natural language processing (NLP) tools in clinical documentation improvement (CI), it is critical to consider several factors to ensure compliance with regulations such as HIPAA and maintain the quality of clinical documentation. Data security and privacy. HIPAA mandates strict standards for the confidentiality and security of patient information. Before implementing NLP tools, organizations must ensure that the AI system complies with these requirements. This includes ensuring encrypted data transmission, secure storage, and access controls to prevent unauthorized access to patient data. Accuracy and precision of algorithms. While NLP tools can enhance documentation efficiency by automatically extracting relevant information from unstructured text, they must be precise to avoid misinterpretation of clinical terminology. Inaccurate NLP output can lead to incorrect documentation, which can negatively impact billing, coding, and patient care. Regular validation and updates to the NLP algorithms are essential to improve their performance and ensure they adapt to evolving medical language. Auditability and transparency. To comply with regulatory standards, particularly HIPAA, healthcare organizations need to maintain transparent documentation regarding the NLP tool's operations. This means recording which data the tool accesses, how it processes this data, and the results it produces. Audit logs are important for identifying and correcting any issues that arise during the tool's operation. User training and integration. Clinicians must be adequately trained to use the AI tools and interpret the results. AI tools should be integrated smoothly with existing EHR systems to ensure they complement rather than replace human judgment. Incorporating these factors allows healthcare providers to use AI-driven NLP tools efficiently while maintaining regulatory compliance, safeguarding patient information, and enhancing documentation quality. How does integrating clinical decision support (CDS) systems with EHRs enhance adherence to evidence-based practices? Answer: integrating clinical decision support (CDS) systems with electronic health records is a powerful way to ensure that healthcare providers adhere to evidence-based practices, improving both the quality of care and patient safety. CDS systems deliver real-time, patient-specific recommendations based on clinical guidelines, research, and medical best practices, providing several advantages. Improved decision-making. CDS systems analyze patient data, such as medical history, lab results, and clinical findings, and suggest evidence-based interventions. These recommendations help clinicians make well-informed decisions that align with the latest medical research and standards of care, minimizing the risk of errors or deviations from best practices. Standardization of care. By integrating CDS tools into the EHR workflow, healthcare organizations can standardize care protocols across multiple providers, ensuring that all clinicians follow the same evidence-based guidelines. This reduces variability in care and helps ensure that patients receive consistent, high-quality treatment regardless of the clinician they see. Real-time alerts and reminders. CDS systems can provide alerts for potential drug interactions, overdue preventive screenings, or inconsistencies in documentation, ensuring that clinicians act on time and according to the latest evidence-based recommendations. This minimizes the chances of missing critical patient safety issues, reducing cognitive load. The integration of CDS tools helps reduce the cognitive load on clinicians who may be overwhelmed by complex medical data. By providing immediate, context-specific suggestions, CDS systems allow healthcare providers to focus on patient care rather than trying to recall specific guidelines or search for information. However, alert fatigue, where clinicians become desensitized to constant notifications, can diminish the effectiveness of CDS. To address this, organizations must regularly refine alert thresholds and ensure that only the most critical reminders are flagged. Discuss the role of training programs in reducing documentation errors in clinical records. How should training content be adapted for different staff roles? Answer: training programs are essential in reducing documentation errors in clinical records by ensuring that all healthcare staff are well equipped to understand and follow proper documentation standards. A structured training approach can address various gaps in knowledge and skills, preventing mistakes that can negatively impact patient care, coding accuracy, and compliance. Role-specific training. Different healthcare roles require tailored training. For example, physicians. Training for physicians should focus on the importance of precise, detailed documentation that reflects the patient's clinical condition and supports accurate coding and billing. Nurses and other healthcare providers should receive training on documenting patient interactions, assessments, and clinical interventions. Coders and billers. Coders need specialized training to accurately assign codes based on documentation. Training should include updates on coding guidelines, ICD-10, CPT, and HCPCS codes, as well as guidelines on documentation sufficiency and the impact of ambiguous language. Interactive and scenario-based learning. Training programs should incorporate real-world scenarios and case studies, enabling staff to apply theoretical knowledge to practical situations. This could involve reviewing sample patient records to identify common documentation errors, such as missing or inconsistent diagnoses, which could lead to billing discrepancies. Regular refresher courses. Given the evolving nature of clinical documentation guidelines, periodic refresher courses are essential to keep all staff updated on the latest regulatory changes, technological advancements, such as HR updates, and evidence-based practices. Audit and feedback. Implementing an audit system to monitor documentation quality is vital. Feedback from audits should be used to fine-tune training content and provide focused retraining for staff making frequent errors. This ensures that training remains relevant and addresses specific weaknesses identified during audits.